Wikidonist.com. Truth about tooth.
Good morning. I am Dr. Thomas Nechupadam from Nechupadam Dental at Marine Drive, Kochi. We have been talking about different costs of things and then the allied costs which can be expected during each treatment. So please understand that costs of different clinics are different, the expertise of the doctor is different, but there can be some of these costs. So you should understand that so that you can ask the doctor, is there any other allied cost which is along with this treatment to finish the treatment. So you should understand it. So if you can understand it, please listen to it, write it down so that before you go to the dentist and get the treatment done, just check it out and then ask for all these details so that your treatment is worry free, so that your budget is fixed to some money, so that your treatment is a happy one and you can eat and chew, also smile from your heart rather than having a grudge to the doctor, or you should not think that doctor has not told that charges or this charges. So just asking plainly what are the charges which is there, and to finish it and to use it as function, so or how much time does it take and things like that, so that it will be a worry free thing. So today we are talking about aligners, and aligners is one of the favorite things because nowadays braces are not very happy because of social media and things like that. Everybody wants to smile, everybody is a rock star, so everybody wants to put the braces off and put aligners to correct their teeth. So when you go to a dentist, what are the charges expected? You should go to an orthodontist to do the aligners. Why to an orthodontist? Because orthodontist knows what all movements has to be done, and you will get a fair idea on how the tooth will move. Otherwise it is all dependent on the company. There are dentists who are doing aligners for from different companies, but the problem is that they are dependent on the company, and the company gives them, and then if something happens, then it's a problem. So if possible, go to an orthodontist, get the treatment done. If it's a minor ones, you can actually look into dentists also. I have no problem. Go to a good one. So the first thing is consultation, ranging from 100 rupees to 1000 rupees, depending on the expertise of the doctor. They might charge you different. Sometimes it's free. So that is one, consultation. Second thing is treatment planning. Then just like in orthodontics, they might take x-rays. Each x-ray will cost you 500 to 600, 500 to 1000, 1500. So they might take an CBCT. Sometimes CBCT will cost you up to 5000, from 1500 to 5000 depending on the machine, so, and the clarity and things like that. Sometimes due to the cost of the retail space and things like that, it can range between 1500 to 5000. Now they might take a lateral serve, that also will cost you from 500 to 1500. So that is the cost barrier. You should expect something between 1000 to 5000 rupees for your x-rays or diagnostic part. Then what else? And in some cases they don't take x-rays if it's a mild case and things like that, with a small diastema. Sometimes they may not take any of these x-rays, so that also may be counted into. Now what else can be done? Then they might take a digital impression, or they might take a physical impression. What is a digital impression? They use a scanner and they do a 3D scan of the mouth, and then they send it to the respective companies, or they might do a physical impression. They might charge you for that. So they might charge you as a package for diagnosis, treatment plan total, including your virtual setup. So that ranges between 5000 to 20,000 depending on the material, depending on the scan, depending on the company and things like that, somewhere around 5,000 to 20,000. So now then comes the aligner per se. So when you ask someone how much does an aligner cost, an aligner is what they hear, and then they might tell from 1000 rupees to 20,000 rupees depending on the company, the material and the package they choose. So the number of aligners is different. So 5,000 rupees is per aligner. So if you are doing a aligner case which is of 5, just 25,000 rupees, which can only make 1 or 2 millimeters of movement. If you are doing a multiple aligners like 20 or 25 aligners, then you understand 5,000 into 25 aligners, that will be a large one like 25,000 rupees. So just understand how many aligners are there, get to a treatment plan, and then take the treatment plan rather than just giving a call up and asking for aligner costs. So it can range from, theoretically it can range from 25 to up to 3.25, but so understand about what is the doctor talking to you. So rather than this thing, sometimes they are giving retainers, because if it is a single aligner, then it is called as a retainer. It cannot move the teeth, so sometimes it is called as a retainer. So don't confuse between aligners and retainers. So understand about it, and then it also might have scaling, it might also have extractions, it might have attachments. So all these may be an extra charges. Some people charge for per attachment, they charge per extraction, they charge per proximal slicing and slenderization, they charge extra. So all these things may be an extra charge. Just ask your doctor before you start the treatment, otherwise you might be charged for all these things. Then at the end you might need to remove all these attachments. They might charge you for that, and they might also charge you for retention, and per visit cost also may be there. And if you are taking an EMI, please ask whether there is any interest charges to it, so that you will understand that also. So make sure that you check out all these things before you start the treatment, otherwise you will end up with losing a lot more money than you expected, and you might not be very happy at the end of the treatment because you lost much more than you expected. So understand all these things so that you will get a good treatment. Also you will keep the budget to your purse size, otherwise you might not be happy. So before you start the aligner treatment, just watch this video so that you will understand more about this, what are the expected costs. Ask all these things, make it into a package. This is the upper limit that you can spend, and then start the treatment so that you will end up with a happy face and a happy smile, or not only because your teeth has been aligned, because you are happy that you spend the exact amount of money. Thank you. If you like the video, please subscribe, please share it to all your friends who are doing aligners. Please give it to all the friends who are planning to do orthodontics, so that they will understand more about this. Thank you very much, and God bless you with a great smile.
Wikidontist.com. Truth about tooth.